Thank you everybody for coming to learn about the hepatitis C virus, or HCV. Some of you are already somewhat aware of HCV is, but the rest of you may have only heard of it by name and not actually heard what it's about. I'm here today to make sure that you understand the effects of this disease, how it's transmitted, and why there are limited treatments and zero vaccines. So, first off, hepatitis C is a viral liver disease, and what this means is that the virus attacks the liver, and you cannot get rid of it by using antibiotics. According to the Center for Disease Control, the virus can live outside your body anywhere from 16 hours to 4 days. The good news is that the liver can repair itself slowly. However, the virus is constantly destroying the liver faster than the liver can repair itself. Some more good news, though, is that up to 30% of the people who get the virus do not develop chronic hepatitis. And even if you do develop chronic hepatitis, it's possible for the virus to lie dormant. Now, similar to the damage of alcohol, alcoholics who destroy the liver do not do it overnight. It takes a long time, and this is also true with HCV. According to HepCtrust.org, sometimes it takes up to 20 or 30 years for a person with the virus to even present symptoms. And just like the symptoms of cirrhosis caused by alcohol, Hep C symptoms are often vague and may be overlooked, such as flu symptoms, body aches, fatigue, and other minor problems. Even for those that do have it, the symptoms are non-noticeable. The problem with this is while they are not presenting symptoms, they are still developing irreversible damage to the liver. In end-stage Hep C, all of the previous symptoms worsen and new symptoms may start to appear, such as gastrointestinal bleeding, abdominal swelling, confusion, brain damage, and even liver cancer. Aside from the symptoms, it's important to know the methods of transmission. The word hepatitis just means inflammation of the liver. Though Hep A, B, and C are all joined by the word hepatitis, they are all very different diseases. Hepatitis B, and even sometimes A, are considered STDs, which is why many people assume C is also. This is not true unless blood is present. Hep A is transmitted by fecal matter, B by bodily fluids, and C is only transmitted by blood. The twisted irony of this disease is that HCV is the most common to transmit, or the most difficult to transmit, yet is the most common form of hepatitis. Being that I currently have this virus, people who hear about it begin to panic and want to know what precautions to take. So I have to educate them to put their mind at ease. Well, the unfortunate truth is that the number one reason for the HCV infection is a contaminated needle or syringe from drug use. This is not to say necessarily that Hep C is a disease which originates from sin. Because Hep C is a relatively newly discovered disease, prior to the 90s, when health facilities began screening their blood transfusions for the disease, they would give it unknowingly to their patients. The saddest case of transmission is when an infant receives it from their mother during childbirth. However, it cannot be emphasized enough that you cannot get the disease without blood contact. There is no way to get the disease from a cough, a sneeze, a hug, or any form of contact which does not include blood. And unlike A or B, Hep C does not currently have a vaccination, although it does have treatment options. To understand the reason for not having a vaccine, the first thing you have to know is how vaccines operate. And that is that a vaccine has to make the immune system aware of what the virus looks like. In a cops and robbers analogy, the immune system would be like the cops and HCV is the robber. The smart robber will use an alias, grow a beard, and try to be unrecognizable. Such is true with HCV. It mutates faster than the immune system can put out bolos. This means that there is no realistic way to teach the immune system what to look for. In conclusion, Hep C is a silent, slow-progressing viral disease which attacks the liver. It can only be transmitted by blood, and it has no vaccine. An important statistic to note is that according to the CDC, approximately 15,000 people die every year due to hepatitis C. There's no mistaking it. Hepatitis C can be terminal. Thank you for listening, and if you think that you may have this disease, please get tested.
Very good.